Welcome to EchoHealth Hub, more than an AI-powered medical scribe. EchoHealth Hub transforms consultations to enhance communication and empower patients. Our platform automates documentation, tailors patient communication, and streamlines administrative tasks, allowing healthcare professionals to focus more on patient care. Let's see EchoHealth Hub in action with a short review of a Parkinson's patient at a neurologist.
Hi, how are you today?
I'm okay, just here for my Parkinson's review.
How have you been managing the symptoms?
The tremors aren't great and I'm feeling a bit stiff.
What time of day do the symptoms worsen?
It gets worse late morning and late afternoon.
You're on a levodopa-carbidopa combination, correct? Taking it 3 times a day?
Yes, I am.
Is the tremor mostly in the mornings?
Yes, especially when I'm trying to read a newspaper or something.
Let's look at adjusting your medication to better control the tremors. Does the stiffness ease at all during the day?
Yes, it gets a bit better once I get started.
Increasing and adjusting the medication may help. How are you managing daily activities?
My spouse helps, but I'm slower and worried about falling.
It's good to have support. You're doing physiotherapy, right?
Yes, but not with a Parkinson specialist.
I recommend seeing a specialist. I'll give you a referral letter. Let's review your medication details. As you know, levodopa is the most effective drug for Parkinson's, and carbidopa helps it work better by reducing side effects. You're on the brand Cinnamon. There.
What are our options for adjusting the medication?
We can consider increasing the dose, but we need to be cautious about side effects like nausea, dizziness, and involuntary movements. We'll start with a small increase and monitor your response.
How will we know if the increased dose is working?
We'll schedule a follow-up appointment in 3 months. Keep a symptoms diary to note any changes. We'll adjust your doses to 100 milligrams/25 milligrams at 7 a.m., 11 a.m., 3 p.m., and with dinner at 7 p.m. Take a half dose of 50 milligrams/12.5 milligrams at 10 p.m. with a light snack. We'll add domperidone to manage nausea, taken 30 minutes before each dose. Seeing a physiotherapist who specializes in Parkinson's will help with exercises to improve mobility and balance. Keep a daily log of symptoms and side effects, which will be valuable for your follow-up visit.
It sounds complicated.
I'll send you instructions via SMS. We need to monitor for increased shaking, unusual movements, and dizziness. Stick to the schedule strictly and keep a daily log. How are you feeling cognitively? Any anxiety or sleep issues?
The anxiety can be overwhelming and I have trouble sleeping due to shaking and restless legs.
Maintaining good sleep hygiene and staying active with reading, puzzles, or learning new skills can help. Let's try amitriptyline for anxiety and restless legs, taken at your 7 p.m. dose.
Thank you, doctor.
You're welcome. Do you have any other questions today?
No, that's all.
Great. Let's follow up in 3 months. Take care.
As the consultation ends, the healthcare professional reviews the generated documentation. They have the ability to update and change what is generated or simply approve it. In this case, the healthcare professional approves the to-do list and the UL for Parkinson's Australia. Now, the healthcare professional can use EchoScribe, the AI assistant.
Additional problems. ppm, dyslipidemia, peripheral melatonin 2 milligram noctate.
The healthcare professional decides to write a referral to the physiotherapist discussed during the consult. Before that, they want to add some additional problems and medications that weren't discussed during the consultation, but are important for the patient's documentation. EchoScribe takes the consultation transcription and the additional information to generate documentation in the format they prefer. Documentation that would have taken the healthcare professional and staff hours to complete is generated in under a minute. Finally, our Parkinson's patient receives an SMS with their approved to-do list and Parkinson Australia patient information site, ensuring they stay informed and engaged in their care.